Our study evaluated the safety and tolerability of SBRT with concurrent pazopanib for pediatric patients receiving SBRT for their Mets from sarcoma. Fortunately, what we found was that the combination of treatment was safe. There was no greater than grade 3 or more acute toxicity related to this combination of treatment. I commonly get asked about the role of SBRT for pediatric patients, and it's something that I actually really enjoy talking about. I think that SBRT is an underutilized tool for our younger patient population. We know that certain pediatric cancers, when these patients present with metastatic disease, can still be curable. We also know that many sarcomas are relatively radio resistant. This is why the tool of focused high-dose radiation delivered via SBRT in 1 to 5 fractions can be such an important tool that we can use this as kind of an ablative tool for children who have oligometastatic disease. Why this is so important in particular for pediatric patients is that we know that they're growing and developing and at higher risk for late toxicities from our treatment. Also, what's so important about this tool in this population is that these kids that we see and look after are often heavily pretreated, meaning that they've had several lines of chemotherapy. They've often had prior definitive fractionated radiation therapy. And that's why, this focused high-dose radiation becomes an important tool to consider. And the blessing is that it turns out to be relatively safe as long as it's done in a thoughtful manner. What also is so important is to consider what the concurrent therapies